can see, I do look a lot better than I did in my 2-week video. Things have been going really well, still very minimal pain, and I think about a week ago I was cleared to start eating soft chew foods. My doctor said, you know, pasta. He also said pizza, which that sounded not very soft, but I've been eating it anyway, as long as I cut it up. So that's the main thing, is just I have to cut up all the food that I eat. But I've been doing pretty well, especially since I started eating again. I have still been doing protein shakes. I don't know if I mentioned that in my other video because I don't know if I was doing it yet. But I have been drinking Ensure Plus. Each bottle is like this big, and it has 350 calories, and it's a really good source of all that, all those vitamins and, you know, those really important calories that you don't really get when you're drinking milkshakes and stuff all the time. Hopefully you can tell I'm talking a little bit better. I have more movement going on here. That is how wide I can open my mouth right now, and yeah, I think I went to physical therapy yesterday. Oh, I have to talk about that. I believe right now I am at 12 millimeters, little more, a little less, I don't know exactly. But they do have me doing a lot of exercises to improve my bite. I don't have them right now. But I will get into the physical therapy part a little later. So I think one of the weirdest things right now that I'm dealing with is stitches, and honestly just getting used to, you know, chewing food like a normal person. If you have any of that jaw resorption going on and you have an overbite, you know you can only eat with the back teeth. So having had that for like 4 years, you know, I'm not used to using my front teeth at all. It's a weird feeling, and honestly I think that my teeth aren't used to being, you know, used all that often. Also, stitches. I get really grossed out by all the medical stuff, so this entire, you know, surgery and this whole journey and everything has been kind of totally disgusting to me. But I do have to show my scars. They're not scars yet, but they're healing pretty well. My incisions are healing pretty well. Usually at the tops and the bottoms of the incisions, you'll get a little bump or something when it's healing. And I had that and I thought that it was just healing weird in that spot, but actually it is a stitch that is coming out right now. It's really gross. I mean, it probably won't bug some people who aren't as grossed out by this stuff as much as it bugs me. It is a little sore just because, you know, I've been kind of messing with it because my physical therapist has been telling me to try to work on it, try to get it, pull it out a little bit. She did say it was optional, but I've had it sticking out for like a week now, and I really don't want to deal with it anymore, so I'm trying to get it out. The stitches inside my mouth have started to come out a little more. It doesn't hurt at all, like, don't be worried about that. The thing, I think they're just dissolving at this point, because, you know, when they come out, I kind of like pressed on it a little bit, kind of rubbed it to test it to see like, is it dissolving or like what, like, or is it healing out? Because I know I've had trouble with the dissolving stitches in the past, because sometimes they just don't dissolve. But so they did kind of come apart easily when I applied some pressure, so I guess at this point they're still dissolving, which is good because, you know, I don't think I necessarily need them to hold me together anymore, so now they're just kind of in the way. The ones up here have been kind of coming down, like, that sounded gross, but they've been coming out a little bit, but not completely. They're like longer ones up here. So they've been coming down and kind of getting like on my braces and on my teeth. But they're still connected in there. So that's been kind of bugging me a little bit. But, you know, I think you're allowed to trim them. I just haven't really gotten around to it, and honestly, I think this side is where it started, but I have been checking in the mirror and stuff, and it doesn't really look like it's there anymore, so I don't know where it went, but oh, that's pretty much all I have to say about the stitches. I'm not gonna show you the stitch that's sticking out of the incision here, just because, ew, you know, it's nothing, you know, exciting. Like, you don't need to see it to, you know, have a successful recovery. You're gonna figure it out. It's not too gross or anything, and the incisions are healing. You can barely see it. Like, I've gone, you know, out on like many shopping trips with like friends, and, you know, I've shown them, and it's clear, so you can't really see it. So really, it's just annoying. Okay, so now I'm going to talk about therapy, which I forgot I needed to talk about, so this video might actually end up a little longer than I thought. Okay, so physical therapy. I have started doing physical therapy. I'm not doing speech therapy. We're considering it. I don't really know if I need that or not, because as you can tell, I kind of have trouble talking normally, but it's not that bad. Like, I am still understandable. It's just some things kind of, and I really want to chalk that up to being a little swollen, being a little numb, just in this area. My numbness has gone down quite a bit, because it was from like right under my eyes down. I can feel a little more in this area now. Really, I don't know exactly where, because to test it, they poke you with stuff and see if you can feel the poke. And I can't do that on myself unless I have something to poke myself with, but we don't need to do that right now. But I've been getting a lot of feeling back. I keep wanting to talk about therapy, but I have something else I need to talk about first. Sinuses. I am like the only one in my family who has never had issues with sinuses or anything. Never really had to deal with that. And I don't know if this is what it is or if it's just a lot of congestion from other stuff, but it doesn't happen as much anymore. But there were like 3 days in a row, maybe 4, that I would sneeze one time, and like for the next like 6 hours, this side of my face, my eye would cry and my nose would run so bad. And like, it was only on this side, so I don't really know. It's just one of those funky things that you deal with after surgery. They were working all up in my like sinuses and stuff, so it's a common problem to have sinus issues post-op. but I don't really know. It hasn't really happened recently, but seriously, one sneeze, and that was it for the rest of the day. You know, so it's annoying. Another annoying surgery thing. Okay, so physical therapy. I keep getting off track. Okay. Physical therapy has been really nice. My therapist is a really nice lady. She's been super awesome. I don't know if I've mentioned this before, but I did play the clarinet in my high school marching band, and I was really worried that I wouldn't be able to play it again, or, you know, for next year, because next year is my senior year, so that's really the only time I'll be able to play again. So I did ask her about that, because, you know, the clarinet is like one of the worst possible instrument choices, along with like the saxophone, for a girl, well, I guess for anyone who is going through this. But, you know, when I picked that instrument, I wasn't anticipating anything along the lines of a jaw surgery. So I was worried that I wouldn't be able to get back to that, but she told me absolutely. Right now it's February, and she said that by the time that I'll need to start being able to play again, which would be July, I would be more than ready. So I won't be able to play when my class goes to Disney, which is the last week of March this year, I think. But by July, when the new marching season starts and we start practicing, I should be good. So that's all I could really ask for. As of right now, I am going to Disney with my band. My band director knows the whole story. I don't have to play, I just have to march and pretend, which is really awesome because, you know, it would suck to have to miss Disney for this. But, so as of right now, I'm going. I haven't really talked to my surgeon about that yet, so I don't know if he's gonna say, like, hey, you can't go to that, because that would just be too much strain. You know, I'm not a big roller coaster person, but I don't want to, you know, risk anything. Obviously, my health comes first, and my new joints come first, you know. Gotta take care of them, because I don't want to lose them. So, that is yet to be discussed. I don't know if there will be a problem. He'll probably just say no crazy rides, and Disney is great for that, because they have all sorts of, like, adventures and experiences and rides that are, you know, friendly for kids and stuff that don't like roller coasters. So, I should be good. So I didn't talk to my therapist about that either. I don't know if she'll have anything to say about that. Anyway, point is, she did say that I would be okay to play my clarinet in the new year for anyone who is wondering about that. I've been on a lot of support groups on Facebook, talking to people who are going through similar things. I've gotten in touch with a few people who just want some extra information, extra tips and help, and really just someone to relate to, and that's been amazing for me, and I really, really enjoy doing that. So if you need someone to talk to about this, and, you know, I understand no one who isn't going through what you're going through can really relate to you. So if you need someone to relate to, someone to talk to, if you have any questions, please feel free to contact me, and I can also get you into some of the Facebook things, the Facebook groups. They are really helpful because I actually got into some of them before my surgery, and it really helps to see other people's success stories and, you know, find people that you can actually relate to, because it's not that common to have a surgery like this. Therapy. I can't stay on track. I don't actually have the paper of stuff that I'm doing, but they do have me doing a couple different things. A lot of it is just stretching and like doing smiles, like, and they've been asking me the whole time, even like in the hospital, to smile and do duck lips, which I can't really do. For some reason, the duck lips always turn into this weird like smile, and I don't know why. So I don't really have a handle on that yet. It's like, I don't know why. I've been working really hard on it since I got home from the hospital, and it's just not something that's come back yet. Basically, little things like that. They do want me to do like sets of like 10 of just opening your mouth, like just kind of working on that bite. I can actually demonstrate one of the physical therapy exercises. It's not cute, but they sent home a little bag of tongue depressors with me, and basically what I'm doing right now, and it'll be a little modified later, is I start out with like four tongue depressors. You put it, right now I'm doing on the sides, but eventually, once I can, once I get stronger, can handle the pressure, I'll do it in the center. But right now I'm doing it on the sides. So you put it, and it'll be kind of weird to talk with this in my mouth, but you put it, resting on the back teeth, as far as you're comfortable with, and make sure that the amount of sticks that you have can move kind of loosely in your mouth. And I'm just gonna demonstrate, because if I talk through it, it's just gonna end up being random noises and it won't make any sense. So okay, and now the other side, which I'm gonna do just because I don't want to be uneven with my physical therapy exercises. Okay, so done with that. So that just helps to kind of stretch your bite a little bit without putting too much pressure on. I hold it once I get to the max that I can handle, and I feel that pull, but it's not too unbearable. I hold it for about 10 seconds, and then I take the stick out, and then, get the rest of them out. So that's one of the things I'm supposed to do 3 times on each side, 3 times a day. Which I'll be honest, I haven't kept up with that as well as I should be, but I don't really know when you're supposed to start therapy. Definitely consult your surgeon. I was actually doing some stuff just to get my my muscles back in order. I've been doing a lot of singing, which I know sounds really dumb. Doing a lot of singing and just kind of looking in the mirror and working on different kind of silly faces, but like I know that looks really dumb, but singing songs where you really like over pronunciate the words, make sure you're making those faces with your mouth, like shaping those letters like O, Ah, E, like really getting that kind of muscle focus back in there. My therapist, I kind of told her jokingly like I was doing stuff, and she said that it was actually a really good idea. So even before you go to therapy, start doing stuff like that on your own. I think I was actually trying to sing in the hospital when my jaw was bandaged shut and I couldn't say anything. But just kind of reteaching yourself how to make those sounds and those motions and stuff can be really good for you, and also it can help widen your bite a little bit just to talk and sing. And you know, when you sing and they have like long like held out notes and you're opening your mouth, and you know, that stuff can just, little stuff can help, and it's kind of fun too. So but I've been doing a few exercises in therapy. They really don't hurt you or anything, like you're gonna be fine. If you're in pain before you go to therapy, I would recommend taking some ibuprofen or something, because they do stretch you, but I haven't had a lot of pain after surgery or after surgery. I haven't had a lot of pain after physical therapy. But honestly, throughout this whole thing, I haven't had too much pain. So, it just depends on where you're at. You know, a lot of people are probably in more pain at this point than I am. So yeah, in therapy, they do, I call it being electrocuted, but it's like electrostimulation or something, where you just kind of lay back and they'll put these things on your face, and I can't feel it when they do it, which I mostly blame on just the numbness and not being able to feel much in this area. But I did actually feel it for like 10 seconds when I went yesterday. And it was not, I think they had it turned up too high for me, so it was a little painful. But it's not supposed to be painful. The guy just walked away, and then when I started to feel it, I couldn't, you know, get anyone's attention. So, but it basically just feels like a tingling sensation in here, so it is not supposed to hurt. It just hurt me because I didn't know I was gonna feel it. The first couple times I did it, I couldn't feel it at all, so they just kept turning it up and up and up until my eyes started twitching, and I was like, okay, turn it down just a little bit, because we don't need that. So it's not supposed to hurt. They tell you to let them know if it's too much, and then they'll turn it down. It's just to send that electricity kind of through here, kind of wake up some of those nerves. The other thing that they do is they do an ultrasound on both sides of your face, just to, I don't really know why, it's just soothing, I guess. And, you know, if any of you, you know, have kids or have ever had an ultrasound, it's basically that on your face, you know. It's, they put the little cold gel on there, and then they just rub it in, and I don't actually know what it's for. It might be for your muscles. I really don't know, but that's what they've been doing. I probably should have asked about that. For those, oh, this is another long video. It's already at 30 minutes of recording, but I'll cut it down. For those of you who are wondering what exactly is keeping me from opening my mouth all the way, you know, this is actually only about 12 to 13 millimeters, and most normal people open at, I can't remember the exact number, but it's like mid to high 40s, like 47 millimeters is the norm, and that's what you want to get back up to eventually. But you know, it's different for everyone depending on your situation. For me, the reason that I can't open is because back when my jaw was back here, the muscles that are right here right now were back here. And because of that, they weren't being stretched. So they kind of they were small. And they were just kind of stuck in this place. And they're really strong because that's all that was holding my jaw together during that time. So when I had the surgery, muscles got stretched out to the normal spot that they're supposed to be in, but because of that, I can't move my jaw as much right now. And you just have to work through that by going to therapy, or, you know, if you don't go to therapy, which I think therapy is always optional. If you don't go to therapy, I think it's optional, but I'm not sure. I mean, I guess everything is optional, but you just honestly just have to work through it. You just have to do the exercises, and honestly, you can do the exercises that I've showed you in this video. So if you're working on getting that to be bigger, also the TMJ concept joints are also something that's stopping you from opening your mouth. It's a combination of the muscles and the joints. And eventually, you know, you get back up to that normal place. Obviously, this is not a permanent issue. But yeah, so hopefully soon, you know, I'll get up to where I'm supposed to be. It seems like a big leap. I started the first day that I went to physical therapy, I was at 8 millimeters, and I'm already at 14, not 14. Okay, well, I was at 14 after the stretching yesterday, but I started at 8 millimeters and I'm already at, you know, probably 12 or 13. The stick exercise is actually really great if you know, don't measure your bite. Like, I don't measure my bite on my own, but you know, every day that you do it, you can see you're adding more and more sticks, and that is kind of a good way to, you know, put a number to the progress that you're making. Like, I went into the orthodontist and I didn't know how wide my opening was, but I told them, you know, I'm opening 8 tongue depressors, and they were like, what? That's what? And I had to explain because it's kind of a weird thing to say. Oh, before I forget, something else that they had me do in therapy, something that the therapist is doing, is massaging this area kind of up here and here, just to kind of help with the swelling and everything. That's, you know, just another thing, because I know that going into therapy I didn't really know what to expect, so that's good to kind of, you know in advance, I guess, because I was worried. For some reason, I had this idea in my mind that they were gonna take some crazy medieval torture device and like crank my jaw open. They did not do that, thankfully. But for some reason, that was just some weird idea that I had before I went in, and I was very nervous about it. But that's not something that you have to worry about if you have similar fears to mine. It's been very nice, very easy. Obviously it can, you know, hurt you a little bit in the moment, but even then, you know, they're not gonna like really hurt you. They're just gonna strain you a little bit. And when you're sitting there and they're counting down from 5 and you're like, please let this be over, just remember that this is for the best. This is to help you in the long term, and it's going to help you recover faster. So I do highly recommend going to therapy. I again have not done speech therapy. That's something that has been brought up by some people who've gone through this, and I don't know if I'm going to do that or not. I just have to figure it out. But I haven't done that yet, and I think that I'm talking pretty well. Once I get my lip muscles kind of back and I can get that feeling back, I think it'll be a lot easier. But I think that's all I have for today, so thank you so much for watching. I don't know when I'll be back with another video, but it'll probably be around the 2-month range, because that is when my doctor said most of the numbness should be gone, most of the swelling should be gone, and that's when I'll look most like me, and when I'll look most like how I'm supposed to. So thank you so much for watching. I hope this helped you out, and I will see you next time.